Hi, everybody, and welcome again to another weekly edition of MedHeads. That's medcitynews.com's weekly conversation on the issues that matter in the business of healthcare. I am Chris Seper. I run medcitynews.com, and I am joined this week with one sole guest because when it comes to health IT, we need no other guest. It is Neil Versel, based in Chicago. Neil covers health technology for MedCity News. Neil, how you doing?
Doing fine. How are you, Chris?
I'm great. It's Friday, right?
It is
And
Friday.
so it is.
It's time for MedHeads.
It's time for MedHeads, and I am just so we have not seen an alcoholic beverage from you, Neil, in weeks, if not months. What's
Would
up
you
with
like
that?
me to run to the fridge right now? It's just
No,
so
I didn't
we're
know.
okay.
Anyway, we miss it, but this Neil's fridge is probably on lockdown. My fridge is on lockdown, and what we're going to talk about today is about getting health IT on lockdown, and namely internet healthcare information security. This week we had a notable reminder of the fragility of ER networks and internet security, and we also had a great essay from one of probably the foremost experts, and definitely someone who takes the bully pulpit when it comes to healthcare information security, labeling it as one of the key issues for 2016. So we're going to talk about all of that, and obviously we want to hear feedback from anybody who's listening as well. Use the MedHeads hashtag, and we have Nicole Oran from our staff listening, tweeting, and participating here in this conversation as well. So Neil, let's start with you. We had an interesting reminder about the fragility of healthcare information technology networks with HCA. Can you give everybody a wrap on that?
Right. Well, according to our reporting, and let me just preface it by saying I was off on Monday and Tuesday when this happened, and Stephanie Baum did the reporting, and then as soon as I came back, she went on vacation. So we didn't have we had a little gap in continuity of care right there, so to speak, which is one problem that EHR implementations face all the time. But anyway, what we think we know is that HCA did confirm that there was an EHR outage over the weekend. It seemed to have been contained last weekend. Seemed to have been contained to Florida, although we don't know if it goes beyond that. But they did acknowledge that it was mostly if not completely in Florida. They blamed it on a hardware storage glitch. They said Sunday morning it limited the use of EHR they said some of our hospitals, primarily in Florida. Full access was restored using alternate data, using basically their backup plan. They had an alternate data center. They said that while working to fix this issue, they used other systems and processes they had in place, which they didn't specify. And they did say it did not affect patient care, but I do actually find that hard to believe that it didn't affect patient care at all, because they did have to, clinicians did have to switch over paper or, doing some offline documentation on their computer or whatever way they chose, which HCA hasn't told us, but I'm sure it did slow things down. So I'm sure it did affect care of at least some patients. For them to say that it didn't affect patient care at all, I think is probably a little oversimplified, maybe a little disingenuous.
Yeah, and I think this isn't a hacker situation. I think it drives home now how kind of ubiquitous EMRs have become. I mean, I think that the areas in HCA, some of the people that work at HCA have never gone on paper, right? I mean, this is their electronic medical record system that went down for a hardware crash, and this wasn't like a 3-hour event, right? It was. I think it started on Sunday and then went into the regular work week. Is that correct?
That's what I understand. Yes.
I mean, how would you? I mean, to me, it sounds like a glitch that's a notable reminder of the importance and the fragility still of health IT networks. I don't know if it crosses into the issue of security issues or vulnerabilities. I mean, where do you place what happened this week with HCA into the whole network of health IT issues?
Well, let's say that computers break. This doesn't seem like a malicious hack like we saw with some of the big payers, including Anthem and Premera Blue Cross out on the West in Washington State. So it doesn't seem like there's any international espionage or any criminal activity going on. It was just the way they characterized it was a hardware failure. And let's face it, computers do break from time to time. Certainly,
I'm on my 7th.
Yes, and certainly it's a lot more complicated than just your personal laptop hard drive crashing, because you're talking about a multi-site hospital system. But you'd expect them to have many backups, or you'd expect them to have obviously more than one hard drive. So if one goes down, others should be able to pick it up. Obviously, they
Gotcha.
have a
Yeah.
data center, that sort of thing. But maybe they didn't build enough redundancy into it. They did say that their switch over. They made it sound like their switch over to their contingency plans went fairly simply, but the question is, why did this go down in the first place? And should some redundancies built in have picked it up so it would have been seamless on the front end to the user?
Yeah. No, good point. Good point. But it was, it's like I said, it's a reminder, and I'm going to do some sharing screen magic here for the audience. Will bear with me as I turn to my computer here. That there is a bigger issue at play when it comes to internet security, and that is, health IT infrastructure, and that's internet security and data security. And John Halamka this week published a column. He had this cartoon as part of it, right? In this corner, we have firewalls, encryptions, antivirus software, and in the other corner, we have Dave, human error, right? And John Halamka said in his column, which I'll reprise a little bit here, is that it is that he is already seeing the issue of health data, health information security as a problem that will grow from 2015 into 2016. It's a bigger issue, and he really recounted, and I'm going to go to some of these. Again, bear with me, folks. I've got multiple computers here going. He recounted some fascinating scenarios that have already happened, and he expects them to happen more, which is interesting. And I'm just going to rattle off some stats here. The traffic on my guest network from visitors using mobile devices has exceeded the traffic on the business network, right? That's huge. Wow. And he talked about some of the issues that were in there. Clinicians are downloading infected copies of Angry Birds to an Android phone. There's a keylogger in it, and massive spam is sent to the email domain, right? Carefully crafted emails encourage clinicians to log into Oracle financials to claim their bonuses. Those financials, usernames and passwords are stolen and are used to direct deposit information into in the real Oracle financials application. Social networks are being used to infiltrate home computers and steal credentials, right? I mean, these are all vulnerabilities that he's been dealing with now, but and he opens it with this very interesting factoid that he met with the Department of Justice Attorney General for National Security, and the message from the Attorney General was, state-sponsored cyber terrorism, organized cybercrime are on the rise, and the only question is not when will a device be compromised, but when. And it's in health IT is fascinating because you have the mandate to share more information, but you also have a rule that you can't lose a byte. And that really is amazing to me. I don't know if you had the same visceral reaction to Halamka's column as I did, but it was a little mind-blowing to me.
Well, yeah, I mean, all of that is true. What you just recounted, all of that is true. There are threats coming from everywhere, and the breaches we heard of in past years usually involved a laptop going missing or somebody downloading PHI onto a thumb drive or something like that, which are just really stupid things. It's calls out for encryption of hard drives, maybe encryption of any data in motion, especially as organizations rely more and more on the cloud.
But I mean, most of the hacks this year have been hitting the payers, right? I mean, I think was it Aetna this year, and we had.
Well, it was Anthem.
Yeah, Anthem. Thank you. Yeah. And so, I mean, but do you worry about hospitals? I mean, to me, payers are the right target. But it sounds like if you go to a big healthcare system, you're just as likely to get vital information there.
Absolutely. Well, I heard a startling statistic a few months ago. I think I've recounted it on MedHeads once before. The VA puts out a monthly cybersecurity report. And I think in the month, whatever it was, July or August, they had upwards of 200 million outside attempts to access their network in 1 month. And that was below their average, by the way.
I mean, that's actually sounds like a small number to me. I mean, I actually think that it's going to grow. And I think this issue that Halamka mentions in passing, I mean, the mobile device in healthcare, right? I mean, we should see it used much more at the end in December of 2016 than we're seeing it now. Home healthcare, extending the use of EHRs, wearables, right? I mean, mobile security in the information security area is going to spike, it seems.
Yeah. And interestingly, HCA uses Meditech as their EHR, and they put Patient Keeper on top of that. In fact, HCA bought Patient Keeper about a year ago. So there were, rumors that they were going to switch over to Cerner or to Epic, but within the last couple of years, but they have not done that. I believe they're still using Meditech, so which is a client server, traditional client server type system, although they do link up. Dozens of hospitals just in Florida and hundreds nationwide. A lot of this information would be on their private. If it's in the cloud, it's on their private cloud. If it starts getting into a public cloud, like a lot of smaller organizations are opting for these days, you might be in for. It might be more vulnerable if the cloud host isn't up to snuff when it comes to healthcare, because healthcare data does need to be protected more than most other kinds of data.
Yeah, I mean, but I mean, banks. I mean, and banks have been hit hard, and others. I mean, if you're grading preparedness, amongst healthcare systems, where do you grade it?
I would have to say, well, first of all, I want to qualify it by saying I'm not an expert on information security.
Wrong. You are an expert. You are Neil Versel, for God's sake.
I am, but last week's guest, Mandy Bishop, on MedHeads, wrote an interesting piece about the HCA breach for another blog. We did link to it, and Stephanie linked to it in one of our stories. I think she raised some good issues.
But no, we're not seriously, Neil. But for you,
I think.
What's your grade? If you're going to grade people right now, as far as their healthcare overall, some hospitals better than others, right? Yes. But if you're giving an overall grade, where are you grading these folks right now?
I'm thinking it can't be better than a C, because a lot of these things keep happening. These things keep happening, and we still see stupid mistakes like, people allowing laptops to walk out the door. Small practices may just turn everything over to their vendor without asking the right questions. We don't even know how many small-scale breaches might have occurred, although they're softer targets than hospitals, but the payoff is a lot smaller too for a hacker.
Yeah, and I think, and you hear it here, folks. Notable health IT expert Neil Versel gives healthcare industry C at most. C at most. But no, I think you're right. And healthcare is slow, and it's not just slow to innovation, it's slow to best practices that can make them better, right?
Yes.
We just ran a story from Kaiser Health News about, ER, emergency room overcrowding, is so bad they make TV series about them, right? Code Black, right? Yes. But yet most healthcare systems don't implement best practices that have been proven to cut down on emergency room overcrowding. I imagine health IT probably is in the same quandary, where they still have best practices and other issues that people haven't been able to implement for whatever reasons. That slowness, I think, C's get degrees was one of my buddies who went to college with me, but not when it comes to information security. It needs to be much more significant. Let me ask this. Have you seen any vendor that impresses you? Have you seen anybody who you think is a great example of either doing health IT right, or has come up with solutions that you think are valuable? You don't have to endorse the vendor, but just approaches or whatever you'd like.
Honestly, I haven't paid too much attention to the behind the scenes stuff at vendors. I get the sense that some of the large cloud hosts, such as Amazon, for example, are so worried that, are so conscious of losing huge business that maybe they do have to put extra security on it, and they know that they're already going to be big targets because they have so much data from so many places, from so many people. I really hope general cybersecurity has been stepped up since the breaches of the last, I guess, year and a half that affected, maybe it was a little more than a year ago, that affected, say, what was it, 40 million or 80 million target customers.
Well, it's so interesting you say that about Amazon.
Like that, yeah.
I think it's interesting you say that about Amazon, because I do wonder, Amazon cloud services are going to become much more aggressive. I think there was a CIO magazine article that talked about how more people were going from the smaller vendors up to the Amazons of the world and the Microsofts. And I mean, many of the outside entrants, as we'll call them outside entrants for healthcare, like Salesforce and others, are very eager to implement their cloud solution services into healthcare. And of course, they all say that they're security bulletproof. But I heard the mobile.
There's no such thing. There's no such thing as bulletproof. Absolutely bulletproof. And
yeah.
No.
And I heard. I mean, if you go back to HIMSS 2012, you had a big push by mobile carriers talking about how they had hospital grade security. And again, I think one of the things that keeps Halamka and other CIOs up at night is the fact that they have to deal with cloud-based security and mobile security, and that's one of the big things, I think.
Yeah. I'd like to think that we're past the BYOD argument from 2-3 years ago. Hospitals know that people are bringing in devices. They are finally allowing people to use cell phones within the even in patient rooms, as long as it's not in the ICU or some other high acuity location with a lot of sensitive equipment. I think they're used to patients and visitors bringing in laptops and tablets and getting on the Wi-Fi network. They segment those off from the clinical networks, though, and from the business networks. At least they should be segmenting them off.
Yeah, and I think I worry about it because I think that if security was tight, you would get to see a continued proliferation of analytics, leveraging the cloud. I think there's a lot of people who can crunch data or assimilate wearable data would love to continue to integrate that into a health system or into a clinical practice. But if I think that if security is not right, those advances will be notably slowed because HIPAA is a lawyer's dream and everything. Yeah, and everything else. And so we live in that super cautious culture that would. I mean, if we can't get security right in 2016, well, then you're going to see a step back on data and analytics and other things like that.
Well, I think something that is keeping CIOs up at night is something we've reported on a bit lately, and that's the possibility or the fear that medical devices could be hacked.
Yeah, no, I think that's a good point. I think that's a great point. I mean, nobody wants their pacemaker hacked, right? And nobody wants so many other wearables that could be
an infusion pump. I mean, you could manipulate the data and give someone a fatal dose, right there in their hospital room.
Well, yeah, and I think that has to be addressed, even if it's a remote possibility. Those are the things that have to be sealed off. Yeah. And I wonder what you think about this. I mean, I do think one of my favorite stories for the week was something that Megan wrote on the McKinsey report. But I think that issue of where we're going to see real progress if it happens is the life sciences folks, the pharmaceutical folks and the medical device folks, effectively integrating digital mobile technology into their treatment regimens, meaning maybe they bundle an app with a drug. But if you can't avoid hacking, if you can't provide security, there's no way that those super cautious sectors ever come close to that, I think.
Absolutely. Yeah. And in fact, a story that I wrote this week that I was gonna highlight at the end of this half hour is my piece about the PricewaterhouseCoopers kind of a 2016 outlook, which they said to get ready for the new health economy that's going to be very consumer centric. Although one of the 10 top issues for the new year, they said, is cybersecurity meets medical technology, because they believe that criminal elements are going to start going after medical devices. It's, they may not be trying to steal identities, but they could do things a lot more malicious, like kill people.
Yeah. It's boy, you've depressed the hell out of me. I was so optimistic for 2016.
Yeah. Well, that's just one forecast. I mean, you're the one who has the word tsunami behind you.
I will never tell if it's all caps or lowercase or what the number is in it. But no, I mean, I do think, boy, there's so many big cliffs that our major digital sectors could fall under. I mean, I think telemedicine is always at the mercy of regulators, right? And there's really, it's pushing a battleship with two hands. And all that potential sits in just the ability for doctors and others just to say, all right, let's go do this in a uniform manner. And now we talk about internet security, and really that has the ability to endanger, it seems, some of our more prominent things. Better use of EMR, digital, right, wearables. Excuse me. I've been hacked.
You've been hacked by a virus.
By a virus, that's right. And that seems to have it. So, man, this is, yeah, I was all optimistic for these things being implemented in a unique way, and now it looks like this is a landmine that could do us all in. Neil, let's go ahead.
Or they could be crying fire in a crowded theater.
That's true. I mean, yeah, I do think that, vendors love to hype things up, right? So a couple of years ago for telemedicine, video was gonna, let's all spend lots of money on video, and that was more hype than real help. But but when you have the CIO,
and
right?
Clearly we went all out on our video production here.
We spend lavishly on video. But no, when you have Mr. CIO, right, talk about healthcare information security, in a pretty lengthy way, that seems to be something interesting.
Yes.
Well, hey, we're going to wrap up MedHeads, and something we do at the end of every MedHeads is we ask all of our guests, our numerous guests that we have on our show, to talk about the story they thought was best. I'm going to go first today, and I did MedCity has gotten in a fascinating habit of reprising long and lengthy reports that only a handful of people read, right? McKinsey reports, PwC, but I love what Megan did. She did a take on the pharmaceutical industry must go digital. Here's why and how, right? And it really dug into a new report by McKinsey, and it talked about and looked at what some of the VCs share as a point of view around how you tie digital assets to pharma. I really do believe this. I think the digital side will flounder to a point until we do have, apps being prescribed, for lack of a better term. How quickly pharma does that, and how the medical device sector does it, and how we reimburse are at our mercy. But Megan really goes into some pretty big depth, looking at the McKinsey report and what was being said there. And so I think it's one of the must-reads for the week. Neil, what about you?
Okay, well, the PwC report that I mentioned, which I wrote on, was it Wednesday? They're saying that healthcare consumers are going to be finally taking their rightful place. Of course, we've heard that prediction before. It's slowly starting to happen. I think the shift to value-based purchasing, it's going to depend on how quickly that happens before we see whether consumers really are going to be taking control. But among the top 10 issues, there were a lot of consumer-centric things, including what they called care in the palm of your hands, mostly telehealth, remote monitoring, diagnosis, and treatment. Everything, becoming mobile, which we've heard before, but both from the clinician side and from the patient side. They're also talking about movement away from traditional care settings into community settings. That could mean retail clinics, that could mean the home. And also, I'd like to, also they talked a little bit about price transparency, and that is something that I think a lot of people are starting to demand, not just individuals, but employers too, because as their healthcare premiums are going up, they want more value for what they're spending. They're clearly shifting more of the burden onto their employees in terms of a higher percentage of premiums that the employee is responsible for, and also in the form of higher deductibles. That's been going on for a long time. That was the impetus behind the Leapfrog Group, which was founded in 2000 by large employers. They wanted to get more value from their money, for their money, and obviously spending has increased quite a bit since 2000 in healthcare. We heard a little more than a week ago that for the first time it topped $3 billion in 2014. I'm sorry, $3 trillion in 2014 in the U.S. And that price inflation is back to about 5.5%, where it had been down in the 2 to 3% range for about 4 or 5 years prior to that. So price transparency is going to be a huge thing. I also encourage people to check out a story that I posted earlier today. It was an interview that I did this morning with our friend Dr. Michael Fratkin, who is a MedCitizen and also appeared on MedHeads a month or so ago.
Great background. Great background. Remember him well. Great background.
Yeah, well, great background. He's all about telemedicine. He's all about telemedicine for palliative care, and he was saying that he thinks that value-based purchasing is the one thing that's going to allow his practice to scale. He's a solo practitioner. He also, is trying to grow his business, from a rural outpost in Eureka, California, a good 5 hours from San Francisco. He said that if value-based purchasing takes off as quickly as he hopes, then he probably will be able to scale, and that palliative care by telemedicine and perhaps other forms of primary care by telemedicine will be able to spread much more widely, because there'll be more of an incentive for physicians to reach out to patients that way. And he expects it to happen by the end of 2016 or early 2017, depending on how fast CMS continues its conversion of payments away from fee-for-service.
Interesting. Well, I want to thank everybody for watching this episode of MedHeads. Don't be too depressed. We weren't hacked. Not everybody will get hacked. But I definitely think
and HCA wasn't hacked either.
HCA wasn't hacked, right? Their computer broke, right? Dilbert slammed a hammer on the wrong thing at HCA.
Yep.
But
somebody tripped over a cord in the basement, perhaps.
Yeah. But there's good things to come in digital health, but there's obviously priorities for 2016 that are going to be big. Yeah. For Neil Versel, I'm Chris Seper. I hope you have a great weekend.